Hello and welcome to another video tutorial by Oxford Medical. In this tutorial I'm going to cover nurse practitioners and nurse consultants. Again, a very topical issue. You may work with nurse practitioners or similar professionals, or you may know people who work with these people. Firstly, what are nurse practitioners consultants? They're essentially allied health professionals who have extended roles. So they're usually trained as nurses, not always, but usually trained as nurses, and they have been trained to perform specific tasks in an extended role. You may well be asked this in an interview. It's a very common question. And the kind of questions that they may ask you are, firstly, what do you think of them? What's your opinion of nurse practitioners, particularly within your specialty or within that particular hospital? They might ask you what nurse consultants are. They may ask you if you think these titles are confusing. And also, they might ask you what you think physician's assistants are. There's a lot of terminology, but essentially these are all allied health professionals. Physician's assistants, nurse consultants, nurse practitioners, nurse epiduralists, they are all nurses with extended roles. Why were they brought in? Well, the two main reasons were, firstly, because of the constraints of the European Health Working Time Directive. It was seen that there was going to be a difficulty in meeting service provision. And it was thought that if you could train some of these very experienced, very competent nurses to do certain jobs, such as cannulation, inserting epidurals, it would take the burden off the junior doctors, particularly at night time. And therefore, doctors would be less tired, doctors would have to work less hours and would have more opportunities for training. The other main drive for this initiative is financial. No doubt there are more and more financial constraints within the NHS today, and these were seen as a cost-effective alternative measure of providing healthcare. Being a nurse practitioner is actually quite an attractive prospect to a senior nurse, because they're often very experienced and have spent a lot of time in the nursing profession, and they haven't had a particularly well-defined career path. They may have reached the top of their career progression very quickly, and this gives them another option to progress further and to motivate them and to increase morale. So it's generally well accepted by nursing staff. Now, you may wonder, what are the advantages and what are the disadvantages of this scheme? The main principal advantage is undoubtedly cost. To employ a nurse practitioner is much more cost effective than to employ a junior doctor to do the same job. As I mentioned before, it increases morale amongst nursing staff. Recruitment into nursing is at an all-time low, and particularly because of the poor conditions, abuse by patients, inadequate staffing levels on wards, a lot of nurses choose to leave the profession. So if there is a very well-defined career path such as this, there is no doubt that it will increase morale amongst the nursing staff. As I mentioned earlier, it enables us to more efficiently meet service demands. So if you have a nurse working a night shift who can do all of the cannulations and take all of the blood samples, it frees up the foundation year doctor to do more clinical tasks, such as seeing patients and examining patients and making treatment decisions. How about the disadvantages? The doctors are very divided on their opinion about nurse practitioners. The main disadvantage that's seen is that it may have an adverse effect on doctors' training. An example of this would be a nurse endoscopist. Nurses are being trained to do GI endoscopies. And there are many examples in the country where this happens very well with no problems. However, you could argue that each of the cases that these nurses is performing is denying us a junior doctor an opportunity to learn this procedure, which is vital to their training as a specialist. The other disadvantage is who has the overall responsibility. Where does the boundary of the nurse practitioner's role end, and where does the doctor's responsibility begin? And this is sometimes poorly defined. And many doctors are concerned that nurse practitioners may actually do things that they're not trained to do. They may actually go beyond the remit of their job description and possibly into territory in which they're unsure and make mistakes. And ultimately, the doctor, the consultant, is responsible for the practice of these practitioners. If you're asked for an opinion on this, I think you have to be very careful and look in the context of how it affects your specialty. For example, you may disagree strongly with the idea of a nurse doing an endoscopy, however you may be in favour of a nurse doing cannulation. So I think you have to be very careful and you have to back it up with a very good argument and see how it actually affects you in your specialty.